Hello Sihat, apa khabar? Hai, saya Sasha Saidin dan selamat datang ke Hello Sihat, apa khabar? Di mana kami ingin bersama anda bicara dari hati ke hati.
Dan saya Doktor Fariza, host podcast pada hari ini. Kita amat bertuah hari ini ya, sebab kita banyak bercakap tentang topik kesihatan. Tetapi dalam kesihatan, dia juga datang topik kecantikan.
Betul?
Dan topik kecantikan ni, ada orang boleh berbicara secara terbuka. Tapi ada orang dia tak berani bercakap secara terbuka. Mungkin kerana stigma dan sebagainya. Jadi pada hari ini, kami berdua amat bertuah kerana dapat seorang tetamu yang sangat berpengalaman sebagai pakar bedah plastik yang terkemuka bukan sahaja di Malaysia tetapi juga berpengalaman luas di United Kingdom. Dan juga sangat segar, sangat berwibawa.
Ini dia pakai suit okay?
Oh,
Macam James Bond.
Tak sabar, okey.
Jadi background sedikit tentang tetamu kita hari ini. Beliau adalah Dr. Kenneth Liman. Beliau adalah seorang konsultan pakar bedah plastik di Prince Court Medical Center. Dan dia banyak ijazah dia ni. Ada list ni. Banyak juga.
Penuh satu paragraf.
Kan?
Yes.
Dia mempunyai ijazah sarjana perubatan daripada University of Aberdeen. Diploma membership of the Royal College of Surgeons, Edinburgh, UK, 2004. Pada tahun 2004. Ada lagi. Dia juga mempunyai ijazah kehormat Masters of Science Health Informatics dari City University London pada tahun 2006. Okay, ada lagi. Banyak lagi ni sebenarnya. Ada dia mempunyai Diploma Fellowship of the Royal College of Surgeons Edinburgh UK FRCS Plastics 2012. Dan beliau adalah seorang yang sangat bertauliah. Dengan pengalaman mungkin di UK banyak nanti kita tanya dia kejap lagi dalam bidang pembedahan plastik, pembedahan estetik, kanser kulit dan juga laser surgery. So pertama sekali selamat datang Dr. Ken. Kita selalu tanya tetamu kita pertama sekali apa khabar?
Khabar baik. So selamat pagi tu host-host yang cantik ni, Dr. Fariza dengan Sasha.
Cik, ni plastic surgeon kau cakap kira cantik.
Tak ada lah.
It means a lot.
Tapi thank you for inviting me.
Your pleasure.
Saya memanglah tak sabar nak bincang tentang subjek-subjek ni yang dekat dengan hati saya.
Betul. So actually saya dan Sasha bila kami buat podcast ni, kita punya fokus sebenarnya nak bridge the gap ya between kami kerana saya ada pengetahuan perubatan dan Sasha seorang selebriti tapi kami banyak informasi sebab kita punya networking banyak orang berilmu dan berpengaruh ya. Jadi hari ini topik dia tentang kecantikan tapi kita tak superficial. We're not talking about beauty skin deep. Tapi kita nak cakap tentang faktor kesihatan di sebalik kecantikan. So sebagai seorang pakar bedah plastik yang bertauliah dan berpengalaman luas di Malaysia, di UK, of course you also treat like skin cancers or injury, burns. Tapi untuk orang yang datang dekat your clinic dengan tujuan nak cantik. So siapakah mereka ataupun klien yang datang untuk cantik dan apakah jenis rawatan popular yang selalu mereka minta daripada Dr. Ken?
Okay. I think first of all kalau kita cakap pasal plastic surgery lah kan. The usual yang orang fikir yang kita buat is pembedahan kosmetik je.
Yes.
Actually sebenarnya apa pembedahan kosmetik yang kita buat actually is only 10 to 20% yang apa plastic surgeon.
Oh, I see.
Buat lah.
Tak banyak lah, not the majority.
Tak majority. So we just to break it down. What is my specialist organ dalam badan? So kalau kita cakap pasal orthopedic surgeon kan, dia specialist is tulang. Jadi for plastic surgeon, our specialism is kita punya kulit. And kulit ni actually is the biggest organ in the human body.
Yes.
Kan? So it covers the whole body. So apa-apa patient I memang pelbagai lah. I mean ada yang datang untuk cosmetic surgery mestilah. Tapi ada juga yang datang untuk skin cancer. Mungkin nak buang tahi lalat, buang cysta. Mungkin ada luka selepas kemalangan ataupun kes-kes melecur. Jadi pelbagai lah. Tapi if you're talking specifically about cosmetic surgery, it also ranges dari budak-budak umur 8 sampai dewasa umur 90 pun ada. So it's a wide range. Yeah.
Kanak-kanak pun ada.
Mesti. And actually the most, kalau kita cakap pasal cosmetic procedure, the 5 most common yang I get request for is macam facelift, blepharoplasty,
Yeah.
breast augmentation, tummy tuck, liposuction, macam ni lah.
Oh, tu yang popular lah.
Itu
Ya.
yang popular.
I think if we jump right into the topic, because sometimes it can be taboo juga kan, talking
Yeah,
about
betul.
plastic surgery.
Yes.
Of course, there's a lot of benefits also. The people tend to think of plastic surgery to some, that will be a taboo behind it, right? I think a example would be like in the movie Michael, where he did surgery on his nose, but there was a mental thing that was
Betul.
behind it, right?
Yes.
So,
yes.
and actually had 2 things. He had the nose surgery, and also he had the skin
Whitening ke?
Whitening.
not whitening.
Sebenarnya Michael
Dia
ada
vitiligo kan? Dia nak
Yeah,
I,
the vitiligo,
I don't know how to pronounce it because people say it's vitiligo. Yeah, some people say, oh, that's not how you pronounce it. Okay, so it's vitiligo. So there's 2 things there. He obviously, like you said, some people maybe didn't know that he had that. People think, oh, he was bleaching his skin or whatever it is kind. So he had to live with that stigma that people thought he was doing bleaching the skin, which I don't know if that even exists. So maybe we can talk about that also. Are people able to bleach their skin and whiten? But let's talk about the first one. About him, he admitted to doing his nose, and there was this mental thing behind it because of what his father used to say. He had a big nose. So I'm sure you face patients like that who go through those kind of things where the reason why they do plastic surgery to change some features on their body is because
Underlying psychology.
yeah.
Yes. And actually in dalam bidang saya, of course there are patients like this because they are seeking help. But actually the type of help they are seeking memang shouldn't be from me lah.
I see.
So part of my job, tugas saya sebagai pembedahan plastikan is surgeon is to actually identify these patients so that we can refer. Kita buat rujukan kepada pakar-pakar psychiatry ke psychology, because patients ni dia memang kena makan ubat, dia kena makan kena ada therapy.
Okay.
But from me, maybe after they have been treated, then kita boleh buat pembedahan kosmetik, but not before.
But it's not necessarily a bad thing. So macam Michael, I mean, it's up to that person. It's their own body. If they want to change how they look. Like you said, certain organs of the, could be their nose, could be their cheekbone or the, chin or whatever. But sometimes if it makes them feel better about themselves, so it's not necessarily a bad thing.
But I think we have to get to the bottom of it lah. So
Yes.
macam Michael ni, I think he had a condition called body dysmorphia. So
okay.
body dysmorphia ni is satu-satunya penyakit yang is mental lah. So biasanya they will focus on something yang cacatan kecil tau, very small atas penampilan dia. And then
Padahal the rest of him looks good. Satu tu je.
Itu je. Then they focus. Kalau sudah buat, even though it looks better, dia masih fokus on that thing. Jadi dia buat banyak kali lah. Keep repeating sampai hidung dia pun dah rosak lah. So I think that is the issue, and that is one of the things that I have to look out for as a surgeon.
So kalau ada pesakit datang to your clinic kan, asking for a enhancement surgery or beauty surgery. Okay, since we're talking about Michael, let's focus on nose. Let's say a patient comes and say, I would like to do something to my nose. So before even we go to surgery, okay, there is like maybe some sort of screening that you see. Is this a symptom of body dysmorphia? Ataupun memang ada defect dekat hidung ni menyebabkan mungkin dia susah nak nafas ataupun sinus or something like that. So what can patient expect when they come to see you for the first time asking for a operation, and when do you actually say no? the surgery is not indicated, or some doctors will say, oh yeah, whatever you want, I will do.
Yes.
Yes. So how do you approach it?
Actually, untuk you're a doctor too, kan? So it's the same. The consultation dia kena lengkap. We have to examine properly pun.
Yes.
So it's all part of the usual cosmetic consultation lah. So there isn't actually any sort of checklist yang kita buat, tak ada questionnaire ke apa, unless we feel there is a need for it.
Okay.
So normal consultation, patient akan masuk, kita buat konsultasi, pemeriksaan yang lengkap, check the past medical history.
Maybe like
check
a
the
brief
smoking
psychology assessment. Just when you talk to them, maybe you get a sense.
Betul. So one of the things that we look out for is kita nak tengok apa yang dia nak capai. Itu realistic ke tak? Kalau dia memang tak realistic, and then I will of course discuss with them lah. Because it's very difficult for me to achieve something that's unrealistic. And then kalau kita buat pembedahan kosmetik on those patients, after surgery dia memang tak terakan beliau. Dia tak puas hati. They look and then they say, oh, I'm not happy with this result.
Yeah.
So it is about trying to get onto the same page as the patient. And during the consultation, kalau I rasa this patient ada, dari segi mental ada issue ke apa, then yes, we will look at questionnaires. Then we'll actually make the patient aware that this is an issue for them. And then kita buat rujukan kepada pakar-pakar yang sesuai lah. So have I said no? Yes. Actually, one of the biggest reasons is dia punya expectations tak realistic.
Okay, could you share with us apa yang contoh-contoh unrealistic expectations?
Yeah.
Macam nak nampak macam celebrity, you want to look like Britney Spears ke? Is it like that? Oh.
So I liken it to you are an artist lah, macam you are an artist kan. You have a canvas that is already painted, because the patient bukannya blank canvas. It's you are coming with something, and you boleh ubah. You can change the anatomy, you can do some things to the skin, tapi you memang tak boleh ubah dia punya facial structure.
I see.
Or body. We are all built differently kan. So let's say if you come to me and say, make me lupa macam Sasha, it's impossible lah kan. Tapi memang ada patient yang datang,
Dia idolize someone.
Dia nak expectation macam ni, susah. Ataupun sometimes as we talk about social media, dia tengok ada maybe actor, actress ke yang hidung dia suka. Then they bring in and they say, please change my nose to this. Itu memang is impossible lah. Because you have your own nose. And kita boleh buat je is only what we can change on your own self. So that's one of the reasons why we would say no lah.
Now, I was going to say, can we talk about the other aspect of plastic surgery where like somebody who's just come off of breast cancer and what would you call it, like if they want to, because sometimes breast cancer they have to
Mastectomy.
yeah, okay. So how do you deal with, because that's a whole different ballgame. That's somebody who is like,
That's a medical reason.
the medical reason, and then I'm sure they're like gone through a lot even before with treatment with the breast cancer and all that, and then now they're trying to fix themselves lah in a way physically. So how do you deal with a patient like that? Because it involves a lot of emotions, I would get.
Yes, these patients actually go through a lot of emotions. The first thing is you nak buang cancer tu. That's the first thing.
Betul.
So at the end of the cancer surgery, they feel a lot of relief. Tapi the other thing that they lose is the breast. So the breast is part of a lady's body, and it plays a very important role in your confidence. How you carry yourself, apa baju yang boleh pakai. So all these things are very important. And by reconstructing the breast, we are giving back the patient apa yang dia sudah hilang.
Betul.
And it can menaikkan keyakinan diri lah. So I think that's quite important. How do we deal with it? There's many types of breast reconstruction. The best type is kalau kita buat immediate reconstruction lah. Here at the time the breast surgeon is removing the breast, kita boleh buat reconstruction at the same time. Jadi bila patient tu sudah bangun, it doesn't look like they've lost their breast. Dia masih ada kat sana.
Okay.
But it's gone.
But the cancer is gone, but the new one already in place.
The new one's already in place. So they don't feel such a big loss.
Okay. Oh, I
Of
didn't know
course,
to do that.
there are some patients who will just opt for the cancer removal surgery. Okay, so in those cases, mungkin 1 year, 18 months down the line, lepas terapi dia sudah habis, then they say, hey, I'm missing something. So contohnya, I had a patient who came to see me maybe after 10 years, dia sudah buang cancer dia, mastectomy semua sudah clear. Tapi she came to me and dia kata, for 10 years, I feel something is missing. You know? So, kita discuss lah pasal all the reconstruction options yang dia ada. And then she decided to go ahead. 6 months after her surgery, she came back and she said, it's the best thing I've ever done with our life. My confidence is increased sky high. I can wear whatever clothes I was on.
Feel like a woman again.
Feel like a woman again. And, you know, she said she didn't realize what the impact would be for her.
And why did she for 10 years?
Because
Stick with it.
because number one, mungkin they weren't given the option at the time,
I see.
kan? So not cancer surgeons biasanya dia about reconstruction. So if they don't involve the plastic surgeon at that stage, memanglah they don't give the option to the patient at the time. Sometimes also mungkin patient pun dia tak sedar there's reconstruction.
They focus on just treating the cancer first.
Betul. They don't want to think about anything else. Itu yang penting sekali. And correct lah. Itu memang yang penting sekali lah. To start with. But you look beyond that. Yeah.
When you want to, on the road of recovery. So recovery is also not necessarily linear. Kan? It goes up and down. And yang paling penting sekarang, I think what we discussed about beauty, now we're talking about cancer reconstructive surgery. So, plastic surgery is not just skin deep, bukan je nak cantik, tetapi building life selepas a life-changing event like cancer, breast cancer. So, I think tu yang macam masyarakat kena betulkan juga the perception. When you talk about plastic surgery, oh, it's so plastic, you know, it's so superficial.
Why is it called plastic surgery? Why plastic?
Good question. Plastic, the word plastic comes from the Greek word plastikos, which is to mold. Yeah, so the word plastic itself is from the Greek word lah. So plastic surgery, I suppose, is surgery to mold, to shape something.
Okay.
And also in terms of cells kan, bila kita look under microscope, because I look a lot at cells, sometimes you have like this plastic changes, so sometimes it describe a changing nature,
I see.
Sesuatu yang ada perubahan. So tapi kita sebagai layman pula, masyarakat kita kalau cakap plastik, kita ingat plastik barang.
Yelah.
Okay, so plastik barang something yang superficial ataupun something yang artificial. Jadi bila kita cakap pasal plastic surgery, so in terms of maybe bahasa layman, you associate the word plastic surgery with something yang artificial ataupun superficial. But I think that's why the podcast is important, because plastic is from Greek word and it also the changing nature of something towards something else. But the changing doesn't necessarily mean it's fake or superficial. It means something is necessary. But in terms of beauty, so let's focus bila ada klien datang untuk mencari pursuit of beauty, dia berusaha untuk mencantikkan diri. So as what Dr. Ken says, ada reasonable, ada yang tak realistic. Okay, so there is where the tanggungjawab is mencari ilmu ataupun informasi. Benda ni sebenarnya apa you punya objektif? Are you realistic or are you just want to enhance? So sometimes because some of my patients also datang because of HR atau pekerjaan lah. Sometimes diorang buat medical check-up, mungkin ada parts of their blood test kena lepas, diorang kena pass certain part of their blood tests, and they come and see me to get help so that they can perform their jobs. So ada tak your clients come, they need some sort of surgery or enhancement so that they can do their jobs. For example, orang yang bekerja di mata masyarakat, mungkin kerja dalam hospitality service atau some sort of service yang mereka perlu berjumpa dengan orang, and for some reason they require something. Ada tak pekerjaan macam tu?
Tak ada actually. No lah, there is. Tapi I think the focus is slightly different. So kalau kita cakap pasal this kind of patients who are looking for some enhancement kan, biasanya they are looking to improve their punya self-confidence.
Yeah.
Not because of the job itself.
Not because of the job
I
itself.
see.
So actually, one of the things that is in sort of the media is that if you're beautiful, you might get a better job.
Yeah.
Or if you're handsome, you might get a better job.
Macam bias kan.
Is it true though? So
Yes.
I think from my point of view, bila saya jumpa patient-patient macam ni, they are, of course, sometimes they are aging. So we know that with aging, with gravity, things are going to fall. Okay, as you age, you lose volume. So there are roles of where you might want to add volume to certain areas.
Yeah.
You know, you might want to lift something to make them look younger. That is part of cosmetic surgery lah. Tapi if you're talking about enhancement, kalau I see patient yang mungkin 20 tahun, 25 tahun, dia nak buat enhancement. What is it we're trying to enhance? So, in the science of plastic surgery, kita memang ada normals. You know, we divide the face into threes or fifths. We look at proportions. What is beautiful? So, what is beautiful actually depends on you punya nationality, you punya bangsa, you know, your specific proportions. Someone who is Chinese, proportion dia tak sama dengan orang Melayu.
I see.
Yeah.
So
So
the face.
the
punya.
face,
The features.
yeah, the features, you know. So we try to normalize. What we normalize is we look at the face and we assess what is missing. Mungkin dia punya cheekbone rendah sikit. Mungkin the mid face dia tak ada support compared to somebody who is, let's call normal lah. We can't say normal because everyone is normal, tapi normal to
Normal range.
the proportions yang kita faham. So if we add volume to these areas, or we subtract volume from these areas, or we lift certain areas, then dia boleh nampak cantik sikit lah. Because we are going back to these proportions. If you look at media and actors, actresses, those people who are beautiful, dia memang ada proportion yang sangat-sangat tepat. So that is what we try to achieve. Also, let's say we see a patient who dia punya proportion actually dah bagus dah, but they're just looking for slight enhancement. These patients biasanya keyakinan diri dia rendah sikit. So if we improve their proportions, mungkin your confidence akan naik. So we know that if your confidence is high, you are more likely to succeed in life. Bukannya untuk rupa, bukannya wajah. But if your confidence is higher, you will perform better in your work life, work and life.
I'm so glad you put it that way because you just sum it. Dr. Ken telah memberi satu rumusan yang tepat. I also been looking for that sentence. Sebenarnya when people do for enhancement or beauty treatment to advance their career, it's not the treatment itself, it's what kind of person you become.
Betul.
Betul
So you
tak?
change your physical, and as a result of that, your inner self becomes better or improves.
Like me, like in the years that I've been doing modeling, because I started really young, but many times I would hear them say, because I have a square face, so they'd be like, I guess the more heart shape or oval face is more popular, maybe in modeling. So they're like, oh, you should go for where they can, I don't know, like shave the, I've
Shave
heard
the
of shave the jaw, so you have a, but from day one I was like, this is what my face is like. But what they do is then they use makeup. Then I'm like, okay lah. So they might shading
Shading, yeah.
or, but yeah. So I've come across that also where they've like there's a certain look that they want. But I said no, I
Tapi is
wasn't.
that modelling in Asia though yang minta certain face shape ataupun kalau you model in Europe, this is what they're looking for because you take
Usually,
Asian.
yeah. When I was in Malaysia, that I faced that. But there are a lot of people who do, like I know some people who are in industry, they do the especially the chin, so they make the chin more
Longer.
pointy.
Yes.
But again, it's up to that person, you know, if they want to do it. But I'm just saying that it happened to me also. When
Maybe
they
in
said-
your line of work kan,
Yeah,
masa you
yeah,
tengah
yeah.
bekerja. Kalau
So,
you tak kerja mungkin you don't even
yeah.
come across.
yeah.
That's why I tell you,
Yeah.
ada tak your client datang because
Yeah.
of their work yang macam models
I mean, like you say, if there's something like the nose, if you have sinus problem or something, then you want, or you fell and you broke your nose and you have to
Yes,
like,
yes.
that's a different story.
Yes, yes.
But again, it depends on that person. It might be down to their mental health, and there's a reason behind it why they have to do it. So there's always a story. I'm sure you have. I mean, you won't share it here, but I'm sure there's so many stories of your patient. There's so many different cases that people that walk through your door
Yeah.
yang nak buat macam-macam enhancement or changes.
I think also to mention is that our perception of beauty changes throughout the years and the centuries.
Yeah, what's popular at
What
the
is
time.
popular, you know, like in the 50s, kalau kita tengok bentuk badan wanita yang cantik, it used to be fuller,
Yeah,
you know,
betul.
more curvaceous.
Macam Marilyn Monroe duduk kan.
Yeah, betul. And then as you go forwards, then you have Twiggy in the 90s, you know, who was very, very slim and she was considered the perfect figure. Kan? And then now it's changed again. Jadi it's also down to trends lah, which I think is quite important to not fall into.
Okay.
Yeah, don't always follow the trends because sometimes apa yang you sudah buat, maybe the trend dah tukar lepas 5 tahun, and sometimes what you've done, you can't really turn it back. So that is also important to know.
Can we get if we go down to the basic of what is a plastic surgeon? Meaning, like, what is it areas that you do cover? Do you cover, like we said, vitiligo? Is that vitiligo? Vitiligo. Do you deal with that also, like the skin disorder? Is it disorder? Skin.
So
And then hair transplant, you do hair transplant. Like this, what does a plastic surgeon? What's the range of things?
what's the range? So like I said just now, our specialty is the skin lah. Okay. Tapi we are surgeons. Jadi kita buat pembedahan on the skin, on the kulit. Right. If you're talking about medical doctors who look after the skin, then those are dermatologists.
Yeah.
Jadi vitiligo tu is pada ruang dermatology lah.
Okay.
Yeah. I do some treatments for the skin, macam lasers. Tapi lasers pun is, it's like a crossover between the two. So that is my range of things. Anything to do with surgery on the skin, saya buat.
Okay.
Yeah.
But is it possible for somebody to lighten their skin anyway in the first place?
There
Can
are
people do
bleaching
that?
agents. I think some of them are not very safe.
Yeah.
Also, there is a trend for vitamin C infusion.
Yes, we talked about it in the last season.
Yeah. So vitamin C infusion ni, if you understand the physiology of the body, kalau you punya vitamin C level sangat-sangat tinggi, your kidneys will get rid of it anyway.
Yeah.
Dalam masa 24-48 jam macam ni, all the vitamin C is gone. So if you're getting an IV infusion of vitamin C, dia mungkin boleh tahan 1-2 hari lah. Lepas tu dah hilang kan. Plus also you are burdening your kidneys because your kidneys have to work harder to get rid of the extra vitamin C. So actually I don't agree with vitamin C infusion, tapi I tahu lah banyak klinik yang they will promote.
We
and
talked
do
about
it.
it in last season because I live in Dubai, and this area where my husband works, it's like the financial center district, and there's a lot of clinics where they call it lunchtime IVs.
Yes.
So people literally come down during their lunch break to have these IVs. When the first time I saw, I was like, what is this? But it's quite popular in.
It's very popular. Yeah.
So it happens.
But I think we should look at the science behind it, and unfortunately, there's not a lot of science that supports these treatments.
Yeah.
But I think I believe in being wholesome about it. You have to have a good diet. You can exercise.
I mean, there's nothing wrong taking vitamin C because we are busy.
Yes.
And then sometimes with career, being busy, taking care of family, kita punya makanan tak seimbang. So it's okay to take some supplements as long as dia membantu makanan tambahan to top up things that you tak sempat makan lunch. Sometimes you tak lupa makan lunch, dinner because you're so busy. That's fine. But I think also when it's actually involving IV, there is a place for it medically. Macam for me, when I treat cancers, patient cannot eat.
Betul.
They have nausea, vomiting, or dia usus mereka terganggu disebabkan kemo atau penyakit. Mungkin masa tu badan tak cukup nutrition. So there is a place for intravenous supplements when medically indicated. But for busy lifestyle to extrapolate that treatment medically and to use it as shortcuts, that's where it's a bit debatable. Like you say, you give high dose IV vitamin C that will be excreted through the urine anyway
Yes.
within 24 to 48 hours. So the benefit that you get is very short-lived. And why do you need high dose vitamin C anyway? Is it for skin lightening or nak cantikkan kulit? There are other conventional and safer ways to cantikkan kulit.
Betul.
So it goes back to the pursuit of beauty, the title of this podcast. Usaha you nak mengejar cantik tu terlampau shortcut. Oh, I want a nose job to fix my emotions. I want enhancement to fix my body image. But no, it actually goes back to your psyche. What kind of citizen are you going to be? What kind of worker you're going to be? And if some enhancement help with your confidence building and it will achieve your cita-cita faster, you are very clear about it, then you can discuss it further with a plastic surgeon yang bertauliah. Don't go to Google,
Yeah.
check.
It's quite dangerous actually.
Yes, that's the thing.
So, not going to name any names.
Yes.
Tapi I have seen patients yang buat, this kind of treatments di klinik-klinik kan. And these clinics actually, bila you tengok dia punya Google review semua sangat baik. 4.8, 4.7, dah beribu-ribu tau.
Ya ke?
Tapi they come out with treatments that are not right atau haram. Okay?
Aduh.
And when I see these patients, like want to fix them, nak buat correction ke apa, I ask them, kenapa tak bagi Google review yang tak bagus lah, give 1 star. Dia kata tak boleh because when they have gone to the clinic, they have signed a waiver.
Oh, wow.
Kata kalau if you're not happy with the result, you memang tak boleh bagi review yang tak bagus.
Macam gag order.
Memang dah
macam
kena, dah ada.
ada.
I see.
So you have to be careful also. I mean, of course, everyone knows about Google review and I think it's a good way to see, look
To
at people,
screen
to
which-
screen.
yeah.
Betul. Tapi when it's done in this way, tu memang tak bagus lah. And
And then you treat the
people are
complications.
unsuspecting. Yeah, and I treat the complications. So I think have to be a bit careful lah. Yeah.
Just out of curiosity, what is the most popular, like, I'm talking about beauty enhancements. What's the most popular
Request.
request or treatment that they ask for? Which part of the body?
Which biasanya is muka lah. Biasanya lah. Because that's the most open part of the body kan. When most of us are wearing clothes, you can hide most things kalau if you're not happy with something.
Because sometimes you do abs also, right?
Yeah, so you also have these machines that boleh enhance you punya abs by passing
Dapat
electrical
six-pack kan?
currents into the stomach to make it
Contract.
contract.
Oh, so it's not what you call it? You don't put anything inside. It's not
Stimulation from outside.
silicone or whatever kat dalam for the
Oh,
six-pack.
yeah. Jangan suntik silicone. One of the big
Because some
problems
people,
in
some
Malaysia.
people do that, no? In
Yes.
Oh yeah.
get the six-pack.
That is actually very dangerous. Injecting silicone. And actually.
But what's the difference between that and breast implants? Is that
Ah.
silicone as well?
Yeah, tapi breast implants is covered in a silicone shell.
I see. Okay.
And the silicone inside the breast implant is medical grade.
Mm-hmm.
Okay. So let's say you bought breast augmentation, you have a silicone implant, but the silicone implant is inside this complete silicone shell and the rupture rate is very, very small. Jadi kalau walaupun bila dia rupture pun the silicone inside dia macam gummy bear tau. You know those gummy bears which kita makan? Dia sangat
Likat.
likat. It's dia pekat kan, dia tak kerak tau. So even it's not liquid, dia takkan go all over the place kalau shell dia rupture. And at the end of it, kalau you nak buang, mudah je, just take the implant out, habis. End of story. Tapi kalau you suntik-suntik semua ni dalam badan you, it goes everywhere. Jadi kalau let's say you get infection from these injections, nak buang pun susah. Then you end up with deformities lepas tu.
Yeah.
So one of the things kat Malaysia yang sangat-sangat popular is suntikan filler dalam payudara ataupun punggung. These are very popular. Tapi dia diharamkan di seluruh dunia tau. Even in Malaysia, Kementerian Kesihatan Malaysia dah bagi nasihat jangan buat suntikan ni.
Apa content filler tu ya? Is it silicone or HA?
Itu yang kita tak tahu.
I see.
So fillers on the face memang is safe lah, because we are injecting small volumes, and biasanya these fillers dia medical grade. Tapi kalau nak beli 1 mil filler untuk buat suntikan ke muka, dia memang sangat mahal. And these patients who are getting the filler injection, so-called filler injection into the breast and the buttocks, they are injecting maybe 500 mil, 1000 mil
Banyak.
kadang-kadang, banyak.
Sebab kawasan yang nak cover tu banyak, besar.
Betul. And then they want to make it much bigger kan.
Ya.
So for the price they're paying, tak seimbang lah. How can you get a medical grade filler at this price?
Yeah.
And walaupun you boleh dapat medical grade filler,
Tapi ada black market tak?
mesti ada.
Mesti ada kan?
Mesti ada. And also you actually don't know what you're injecting. I have removed some fillers from patients from the buttocks.
Yeah, that'd
and
be part of your
breasts.
job also to
Yeah,
reconstruct, to
to
repair kan?
Betul. Because they come in with like ketul-ketulan tau. Ketul-ketul.
Dia tak uniform.
They keras, they get infections. And then as a health warning too, bila you suntik filler dalam payudara you know, as a certain age you start to have, you kena buat mammogram kan to check for cancer.
Macam mana tu?
So this filler actually dia rupanya mimic macam cancer tau. So bila you buat mammogram, you tengok dia punya rupa, the radiographer cannot tell the difference between the filler and cancer. Jadi macam mana? You nak buat screening ke? So kalau memang nak buang semua filler dalam payudara, you kena buat mastectomy for something that is not necessarily didn't need to have done in the first place.
Yeah. So it's so important to go to the right doctor.
It actually
It's number
full
one.
stop, don't inject
Yeah.
filler in your breast or your buttock.
Yeah.
Itu saja.
I
End
saw
of story.
there was a trend, or I don't know, a trend was still happening, but in Africa, in a lot of African countries, where they want nice big round plush behind,
Yeah.
and they inject. I don't know, they inject or but it's chicken stock cube. I saw this video because I guess the cube it has a lot of fat in it, and because they don't go to the doctor and all that, or mungkin somebody in the village offers. Yeah, they and I don't know where you can look it up and see, but I was like, they go to that
Extend.
because in their culture, in their society,
The bigger the better.
yes, and that's what they were putting in their bodies.
Yeah, but it's quite scary lah. It's quite scary. So I think be careful of these things.
Yeah.
And
Yeah.
it's not cheap juga tau. So
Yeah.
I've heard sometimes these filler injections can be 20,000 lebih for the breast or something like this. Of course, they are saying it's hyaluronic acid. Hyaluronic acid is a naturally occurring protein in our skin. Jadi biasanya dia akan hilang sendirilah. Maybe after a year or two. Sepatutnya.
Your body absorb it back.
Sepatutnya, ya. Tapi actually, the majority I see, dia takkan hilang. After many years pun tak hilang. And maybe it's because they're injecting such large volumes, kan? So your body can't get rid of all of it. So it's something that is really not good. It's outlawed around the world.
But isn't that what Botox is? It's like when you do Botox and then if the body absorbs it after a while. Basically, Botox is like muscle relaxant, right? It's what it does.
But Botox is macam HA tu dia protein yang absorb water, I think.
Yes.
Tapi Botox is a protein from bacteria, I think.
It's
It's a
what we call a neuromodulator. So the muscles have a receptor that accepts the signals dari our brains lah. So it's all chemical signals. The Botox blocks the receptor. Jadi that's how it freezes the muscle. It doesn't allow the chemicals from the brain to attach onto the receptor. Tapi your body will break it down. Mungkin lepas 3-4 bulan, dia dah hilang dah. So
Okay.
that's actually quite safe.
Yeah, so is it safe?
It's quite safe. Tapi there's also medical grade for injection and research grade Botox.
Okay.
Research grade Botox too can be 100 to 1,000 times stronger than medical Botox. So if you don't know the difference and you, let's say you go to,
Klinik.
orang-orang yang tak beritahu dia, then if you get injected with this research grade Botox, you can actually die. So yang tu pun you kena tahu.
Boleh tak Dr. Ken beri sedikit penerangan kepada pendengar kita? We mentioned the word medical grade banyak. So untuk mereka yang mendengar, mungkin dia tanya, apa maksud medical grade? Apa ada grade-grade ni apa? Medical grade ni apa? How do you decide the spesifikasi ataupun piawaian ataupun dekat botol tu ada label ke cakap ni medical grade? Macam of course being a medic I know lah, but for the
Non-medical viewers.
when you say medical grade, dia pun macam kita nak check medical grade tu apa. So macam for Botox, HA or fillers kan for face yang medical grade mean approved by KKM ataupun and it's used by orang yang bertauliah yang ada lesen. Spesifik macam I'm a hematologist, I tak ada lesen plastic surgery or aesthetic, so maybe you can talk a little bit about the legislation ataupun how to put reassurance back to the clients that this is done correctly.
So I think it comes down to two issues lah. First of all, the injector ataupun doktor yang buat treatment tu, first thing is you kena buat research. Is the training good? Kalau dia sudah buat dia punya training and they are fully qualified doctors and they have, as you say, lesen to buat benda-benda ni. So in Malaysia we have something called an LCP. LCP license tu ada 1, 2, 3.
LCP tu apa ya?
LCP
License something.
cosmetic practitioner.
Yes. LCP.
So LCP 1 is bila let's say you are a doctor tapi you pergi buat kursus and you learn something about fillers, Botox, lasers macam ni, then you get LCP 1. Okay, so LCP 1 are doctors who are trained to do injectables, lasers, and these kind of very minor procedures. Minor procedure maknanya just injectables and
Ringan-ringan sikit lah. Okay.
then you have LCP 2 which are dermatologists. So dermatologists pun boleh buat injectables, fillers, Botox, lasers pun ada, tapi they also have further qualifications in doing other treatments for skin conditions. And then LCP3 are basically plastic surgeons. So LCP3 maknanya we can do all of it lah. And we can do surgery too. So I think one of the other issues in Malaysia is ada juga qualified doctors yang buat pembedahan kosmetik. Actually they are not really qualified to do these cosmetic procedures. So that is something else that patients need to be aware of is kalau you LCP1 actually you memang tak boleh buat lah procedure kosmetik. Surgical procedure, pembedahan. So the other thing is kita cakap pasal the actual things that we are injecting.
Yeah.
So what is the difference? Kalau you all these things are made in a macam sterile environment kan. Tak ada kuman, tak ada bacteria.
Bersih.
Memang bersih. They come in packets which are sealed. Okay, so that one is memang dia sudah disyorkan lah. That is okay for you to use. You kena cook up packet tu in front of the patient. You see, look, this is a original product.
Yeah.
Tapi I've also heard of benda-benda tiruan lah di Malaysia.
Ni yang black market tu.
Ada black market. But black market pun you don't know. Sometimes they tiru dia punya packaging saja.
Dalam tak ori.
Dalam tak ori. So I think this is something that 2 tahun lepas I balik ke Malaysia, I pun shocked to see this kind of thing. So I think the main thing is kat Malaysia banyak-banyak scam kan. How do you avoid scam? If it's too good to be true, dia memang not true lah.
It's too good to be true. It's not true.
It's not true. So if kalau benda-benda ni dia sangat-sangat murah, then you stop and question
Tu dah
yourself.
jadi red flag kan?
Tu dah red flag dah. Is it real ke tak? I had a patient come in, dia nak buat suntikan payudara, and it was done in a hotel. And yang apa
In
yang
Malaysia?
in Malaysia, and apa yang dia explain to me, the patient, the doctor came in, so-called doctor, dia bawa baldi merah tu, yang kita
No
guna kat tandas.
way.
And baldi merah tu, he got all these 50 ml syringes dengan
Wow.
jarum-jarum yang panjang, all filled with
Hmm.
this kind of clear material. Dia pun tak tahu apa.
Hmm.
It's not inside any packets or anything. It's just in this.
In the baldi.
And then the patient said, are you a doctor? Can I see your qualification? Dia kata, I'm a doctor. I didn't bring my qualification. Tapi kalau you tak nak buat, you boleh keluar sekarang.
Dia pula marah.
Dia dah bayar dah.
Dah bayar dah. Tak boleh
Tak boleh
dapat.
claim.
Tak boleh dapat.
Tak boleh refund?
Refund. Jadi, she went ahead and do it lah. Tapi lepas tu regret. And then came to see me nak buang semua filler tu.
She has complications from it?
Yes, of course. No, but kat hotel with benda apa.
Itu pun dah
Yeah.
red flag kan? But why did she go ahead and do it when she already have doubts?
Itu saya tak tahu. So, I think that's up to individuals lah.
That's why awareness must be
Betul.
in the pursuit of beauty. Nak cantik, usaha nak cantik tu jangan jadi, don't make silly
Don't make silly
decisions.
mistake. Okay, put it this way kan. Let's say you nak bag yang cantik. Handbag yang cantik. Okay, you will go and look for an offer somewhere.
Discount,
Kalau you dah cari
sale.
discount, okay, you want to save money on that, go ahead. Tapi kalau you nak suntik benda-benda dalam badan
Badan.
you, don't lah go and try to save a bit of money here and there.
Yelah.
Cari orang yang bertauliah, make sure you get a good product, and go ahead, fine.
And what do you think about those ada yang buat this treatment dekat negara jiran kerana negara jiran, contohnya ada yang kawan-kawan pergi ke Thailand atau Turkey, macam these places are popular for
Betul.
cosmetic tourism maybe.
Especially ni, I was going to ask actually about Korea Selatan. It's very, South Korea dianggap sebagai negara dengan kadar pembedahan plastik tertinggi di dunia.
Yes.
This is what I read online. Dan terkenal sebagai ibu negara pembedahan plastik dunia. Followed by the US, Amerika Syarikat, di mana America has the highest jumlah prosedur pembedahan plastik estetik tertinggi. And some people said, especially I think South Korea because it's closest to us kan. Ni semua pengaruh media sosial, what they see on media social. And then like you said, it's a way for them to maybe go further in their career or maybe get that job that they want to get. So we also have the K-pop culture and the Korean dramas. Kan? I mean, not say they're not bad influence, but because I think it's already become part of their culture and they accept.
And you buka social media pun you nampak.
They accept
everything.
plastic surgery like it's
Norm.
normal
It's
to them.
normal.
It's become a norm. So would you agree that these countries, especially South Korea and America, it's become a norm for them
I
there?
think Thailand also.
Thailand pun banyak.
Turkey.
Yeah. So I think when you look at this, memang lah negara-negara macam Amerika Syarikat, Korea Selatan, they have a lot of cosmetic surgery. And of course, adalah pengaruh dari media sosial and K-pop. K-pop memang dah besar kan. Even Amerika Syarikat pun ada K-pop dah.
I think because like in South Korea, they even have a package where they check you in and then like you go for it and then ada aftercare and then macam pergi vacation pula. Macam tu kan.
So, I think we have to look at dia punya budaya and what is their social norms. Okay, so kalau kat Korea Selatan, the social norm is macam ni je. When you turn 18, kadang-kala you're gonna get a voucher from your parents as your gift for plastic surgery.
Oh wow.
You tahu tak?
No, I didn't
Yes,
know
that happens in Korea.
Okay.
So, that is their
Macam
normal.
macam gift card kan?
Macam gift card. That is their normal. Dia sudah, sudah biasa macam tu. So, you cannot actually extrapolate that to macam Malaysians lah. Kita orang, kita konservatif sikit.
18 tahun you get a cake.
Maybe a car.
And maybe a driving lesson. Enroll you to a driving school.
Yes.
So how do you think that affects the masyarakat South Korean as a whole? I mean, I think obviously it must be the younger generation that has started this culture of going for plastic surgery.
Mhm.
But you said that even parents are giving gift cards,
Parents
so
pun
it's
dah terima.
parents pun dah terima. But as a whole, that their mental state is there a positive?
I think you have to look at it in a different way.
Mm.
So dekat negara-negara ini, pembedahan kosmetik dia bukan dilihat sebagai sesuatu yang tabu lagi. You know, it's no longer a taboo. Itu dia bahasa dah. Tapi dekat Malaysia, we still see it as a taboo. Kan? Oh, you pergi buat pembedahan kosmetik, ini kecantikan saja.
Why Why do you think? I mean, you've seen so many people in your clinics, Malay, Chinese,
Betul.
Indians, and
Yeah.
even international clients
Yeah.
across the world, kan? Clients, and even you are experienced in treating this kind of disease in UK. So you have the Western world, and now you're back in Malaysia, the Eastern world. Kenapa you rasa? What's the actual reason this is a taboo in our culture? What's the actual thing? Makes it
I think it's misinformation and misunderstanding lah. Which is hopefully what this podcast will try to address.
Yes.
Biasanya it's usually down to keyakinan diri. So in negara-negara macam Amerika Syarikat, Korea Selatan, pembedahan kosmetik tu bukan tabu. Jadi kalau dia nak meningkatkan diri, kalau dia nak meningkatkan keyakinan diri, they are not afraid to go ahead and do it. You faham tak? Let's say
Maybe
it's something
better quality of life.
yes, for them it's like I'm improving myself. You know, why not? Why
And
not?
then the society also accept the pursuit of improving themselves.
Betul. And for them it's biasa. Oh, you went to see a plastic surgeon. Oh, normal lah. I went
Macam
last
pergi
week pun.
dentist kan.
Tapi di Malaysia it's still a taboo. But actually, should it be seen as a taboo? I don't agree with extremes juga lah. It's also not right. You know, you should try to accept yourself too. Tapi memang kalau ada apa-apa yang you tak suka, that's making your confidence low, and you can correct it with cosmetic surgery or plastic surgery, why not? We just have to look at the other extreme. Kalau you are a lady and you never develop breasts during your puberty, okay? And you tell your friends, nak pergi buat breast augmentation. They will say, kenapa you nak pursue dengan kecantikan? Why you want to make yourself look
You
good
nak
all the time?
ubah penampilan diri.
Why? Tapi sebenarnya wanita macam ni, keyakinan diri dia rendah. Dia nak pakai baju berenang pun tak boleh. Dia nak pergi beach pun dia rasa malu sikit. So after they have a breast augmentation, you are turning them back to apa yang kita rasa normal in society. So they feel that their confidence has increased. Dia boleh pakai baju apa yang dia pun nak, and she doesn't feel like she's being looked at. That's important.
Yeah, and also I live abroad for many years also, and when I come back, it goes back beyond the beauty or the procedure. It actually goes back to mental health. I mean, I'm not. Of course, mental health is now being talked more, but it's actually sometimes the discussion about mental health and things. Kalau kita nak cakap dengan lebih mendalam, kadang-kadang perbincangan tu tak boleh pergi jauh kerana terus ada misconception atau judgement. You shouldn't change your original body. You shouldn't change what already is given to you.
Yes.
You shouldn't change this. You shouldn't change that. Accept it and suck it up and move on with it. But for that person, that girl, she has to build her inner confidence, and she knows she has to be responsible for herself. So tu yang dia mungkin buat sesuatu tapi dia buat diam-diam. Bukan sebab dia tahu benda tu salah, tapi dia tahu kalau dia open about it, then she get judged.
Yes.
So I think what I say might be, a lot of people might not agree, but sometimes it's an open secret.
Yeah.
This thing is an open secret.
I think whatever you do to yourself or apa-apa yang you decide to do is actually should be your own decision.
Yeah.
So kadang-kadang I will see patients who come in, they kata, oh, my husband wants me to do this. Tapi I said, what do you want? Dia kata, oh no, I'm actually happy.
Yeah.
Then I say, jangan buat lah. Biasa, this is your body.
Yes.
You leave it alone. You jangan, follow apa yang orang nak.
That's people
you nak
pleasing
buat.
and
You're not
and
pleasing
validation.
other people. You should please yourself
Yeah.
to improve yourself.
And that goes back to her confidence of saying no, or her confidence of being comfortable in yourself kan. So, dia memang ada elemen mental health kat situ. It actually goes back to you.
Yeah.
So dengan taboo doesn't help. You know, the fact that people are not talking about it doesn't help. But just be honest with yourself, and if you want to do something, be honest why you want it done. And also please see seorang yang bertahu lah. Yeah, don't go black market.
Yeah. I want to ask, if we look for examples, let's say celebrities in Hollywood, and then again, I think it's definitely a norm for them to do plastic surgery, especially as they grow older, right? But even kita pun macam orang biasa, kita tengok kan, kita pun can identify, okay, they had their eyes done or they had a whatever kan. But why is it that certain celebrities, you know, because sometimes you might look at, oh, she had a bad plastic surgery. Her face looks so good. She must have a good. Is it down to the actual plastic surgeon themselves, or is it the technique that they use, or is it whatever? I don't know. The things that they put, the fillers or whatever. What is it down to? Is it the actual plastic surgeon that
The skillful
the
surgeon.
skill kan? Oh, she's got good plastic. I want to go to her plastic surgeon macam tu kan.
So she has something there, but kat mana cannot tell. You know, that's so subtle.
Yes. It's a very good question actually. So I think if you're looking at really good plastic surgery that is done well, orang tak perasan pun. You know, when it's done well, you just say,
Nampak fresh.
pergi holiday ke?
Yeah.
Or you potong rambut ke? Or something like that. You know, they notice something is different tapi dia tak perasan ni apa yang sudah ubah. I think that is where plastic surgery has been done really well.
Does that come from experience maybe?
So I when I was in UK, I was training a lot of junior doctors lah. Okay, so our training is memang lama sangat lah. But when I'm training them, you can actually tell siapa yang ada dia punya natural talent, ada natural skill, you know. I as sebagai contoh lah, kalau you nak buat, let's say some renovation kat rumah you, maybe you will ask 3-4 contractor bagi quotation, you see what dia nak buat, maybe you go and see the work that they've done previously. Semua tak sama kan?
Yeah, betul.
Some of them won't be so good, some of them could be extremely good.
Betul.
Sama juga dengan surgery. Because surgery, we are using our hands. So, it's a skill that you learn. So, for me, if you start at a certain level, then when you come in as a trainee and you have some talent already, and you train, you can get really amazing results. You can become a very good plastic surgeon. Tapi kalau you masuk training, tapi your level of skill dia tak tinggi sangat lah. You can do it, tapi you are not as amazing as this guy, for example. Then you train, you can only get to a certain extent.
Yeah.
So of course there will be differences between plastic surgeon around the world. Mesti ada lah. Depends on your level of starting skill. Depends on you punya training, where you have learned your trade and your experience. So to answer your question, it's a bit hard to know unless we're looking at specific patients. Kadang-kala sometimes they have had too much injectables, too much filler. Kadang-kala the surgery has gone wrong, or maybe a different technique. Contohnya, let's say we look at facelift. There's many ways to do a facelift. But not every surgeon can do every type of facelift.
Oh, okay.
Yeah, so that is also important.
Why is that? Because it can be quite tricky, the procedure? Or?
Yes, so the gold standards of facelifts are a bit more difficult to do. You do need more training. And of course, the higher risk lah. So some surgeons will choose not to do these procedures because maybe they've not been trained to do it, or they've not had the experience, or they want to avoid the bigger risk of that surgery. Yeah, as part of the risk is you harus bincang dengan patient juga lah, what they are trying to achieve. That's important.
Yeah. So do you think I think we mentioned this just now. So somebody can get addicted to plastic surgery though, right?
I think it's a very slippery slope, especially when the treatments have been successful. So then you realize, hey, I can actually improve myself further. I wouldn't necessarily call it addiction. Dia mungkin confidence dia rendah sangat. And then they see things that they can improve.
Right.
And then if they want to improve it, why not? But as long as you understand the potential benefits and the risks, and you decide that it's okay for you, and you've discussed this with, surgeon yang bertaliah, then okay, why not? Yeah.
So as a plastic surgeon, I mean, this is like can be entirely your own opinion yourself. So what would you say to somebody who says that someone can age gracefully as compared to somebody that wants to opt to take plastic surgery as they get older?
Why not? I think both are not wrong. Yeah. Some people are happy in their skin. They say, I'm happy to age gracefully. Some might say, you know what? I ada banyak tenaga. I've retired now. I now want to explore the world. Tapi sometimes these patients, bila dia masuk klinik I, dia kata, doctor, the comment I get, orang sentiasa cakap, I rupanya macam sangat letih. I look very tired. But I'm not tired. But I get this comment all the time. And that's actually because wajahnya rupanya dia sudah tua sikit lah. Eye bags, maybe the jaw, maybe leher dia nampak.
Oh, also the eyelid kan? You say the eyelids also.
Drooping tu.
Dia nampak letih sangat kan. So they have the surgery to, make themselves look a little bit fresher, younger, according to how they feel in themselves. Tapi actually yang penting tu, everyone is different. Jadi if someone who is happy to age gracefully, and talks to somebody who wants to have the cosmetic surgery, janganlah try to impose your own sort of views on that person. Oh, you are doing it wrong. You shouldn't. You should just age gracefully. Everyone is different.
Betul. When we talk about age, we talk a lot about mature people doing plastic surgery. But what about the young people? Like how young would be too young, would you think, for somebody to start doing plastic surgery? Because at what age does the body stop changing?
So what age actually depends on what the issue
I
is.
ask that because the younger generation on social media, they see all this. So it's like during our time, we didn't have social media. So we're not always looking at, oh, I want to look like this, like mungkin sekarang ni, yang generasi muda ni dah lebih terpengaruh lah dengan media sosial. But just like you as a doctor, like how young do you think, is there such thing as too young to start doing plastic surgery?
There is such a thing as...
I mean, aesthetic.
I don't think the age is important, to be honest. I think it depends on what the issue is. For example, let's say bayi yang dilahir dengan kelas that's reconstruction. We talked about yang wanita-wanita yang tidak ada payudara, right? 18 years old, the breast is stopped developing.
Yes.
Do you do a breast augmentation at that stage? Why not? If they are feeling a little bit, affected by it. Okay. But if a 20+-year-old comes to me and says, I know about facelift, then of course I would say you don't need it because your face hasn't aged that much. This is where pengaruh social media too actually can be detrimental to these patients because they see the results and they say, oh, I pun nak buat macam tu, tapi actually
It's not relevant to you.
It's not relevant to that person yet. Maybe in 20-30 years it might be, tapi not at that age lah. So that's why the consultation process too amat penting. For me to understand actually what is they are coming for and whether or not they would benefit from procedure yang they nak. So I think that is where the expectation is important to know.
Actually, banyak lagi kami nak tanya Dr. Ken, tapi disebabkan faktor masa.
Saya soalan lagi. Soalan out of the box. So kalau orang buat facial reconstruction ke, or not, maybe not necessarily major lah, tapi kadang-kadang like there was this Hollywood actress, she had a nose job, and then I think what movie was she in? I can't remember. Anyway, she had a nose job, and that completely changed changed her face. So sometimes like it's true, right? If you have like you change your nose, sebab orang tak kenal dia. And then her acting career kind of like didn't go as well as it was
Oh no.
because people had
It's the opposite effect.
it's the effect. So, but anyway, that's not my point. My point is sometimes it can change your whole face, your whole feature. So sekarang ni dengan zaman facial recognition when we go to the airport and that kind of thing kan, or on our smartphone nak unlock phone semua kan. So how does that eventually, because I think it's going to get more and more towards AI using facial, like I said, facial recognition and all this. So eventually macam mana kalau nak, if the face is like changed.
It already happens in the airports kan.
Ya ke?
You pergi, ada gak cerita you pergi certain countries you buat face surgery and then bila you
tak
balik airport, the immigration says, hey, muka you tak sama dengan.
How does that work? Like if the face does change, do they have to go and, I mean, but this is maybe like certain cases lah, they have to pergi ambil gambar balik ke. I don't know if this is a silly question lah, kena pergi ambil
It's not a silly
gambar
question
balik ke for
actually. I think
passport ke.
yang kita sudah bincang tadi, actually good cosmetic surgery, good plastic surgery, memang orang tak perasan. Okay, so
the
I think
subtle.
it should be subtle, and what we're trying to do is not change your face. Bukan tukar rupa you macam orang lain.
Exactly.
That is not
that's
the
very
point.
good.
Yeah.
That's a good point.
Tapi in those cases where mungkin orang-orang ni dia tak dikenal oleh face image atau AI kat immigration tu, biasanya it's because maybe they have travelled, they are doing cosmetic tourism. Jadi dia baru habis dia punya
About procedure.
procedure.
So lalai.
Jadi dia bengkak lah. Dia, maybe the face is a bit more full than
Edema.
usual.
Yeah, bruising. Yes.
Macam ni. So of course the computer pun nampak ini bukan orang dalam pasport ni.
Tak boleh masuk.
Tapi actually if you give them maybe 6 months, 1 year down the line, I think it'll be okay lah.
Maybe okay. So what do you think in the future, I'm talking about 20, 30, 40 years ahead, what is the future of plastic surgery?
I think it's going to be a bit more open because I spent, I was in UK for 28 years. Okay, so when I come back to Malaysia, I see Malaysia as being maybe 10 to 15 years behind what UK is
Okay.
currently. So as the taboos lift, as people understand the plastic surgery and cosmetic surgery a bit more, then it will become more common, I think. And the focus should really be on, we talked about mental health, improving one's confidence, giving things back to normal, trying to tukar your punya badan, your image to something that is more to normal. Yeah. So I think that's where it's probably moving towards. And of course, there's lots of new technologies coming up.
Yeah.
Well,
Yeah.
Okay. But thank you so much, Dr. Ken.
It's been a pleasure.
I rasa satu perkongsian yang sangat jujur lah, sangat honest and membuka mata, dan
Betul.
bukan senang nak dengar sendiri daripada pakar tentang selok-belok ataupun how you reach a decision, sebab pencarian kecantikan ataupun the pursuit of beauty, bila kita melihat diri kita di cermin, bukan setakat nak melihat apa yang di cermin tu, tapi sebenarnya kita kena lihat di dalam diri dan kita kena jujur apa sebenarnya yang kita cari. Sebab tu bila kita betulkan apa-apa defects ataupun kita nak enhance, kita bukan nak merubah menjadi orang lain, tetapi sebenarnya maybe nak enhance atau improve diri sendiri. Tetapi dalam subjek yang penuh dengan tabu dan misinformation and judgement, kita juga kena renung bagaimana kita approach apa-apa subjek dengan informasi yang tepat dan juga dengan penuh kejujuran. Jadi maybe saya juga nak berpesan, kalau sebelum buat apa-apa, cari doktor pakar.
Betul.
Cari sumber yang menggunakan medical grade products dan juga yang ahli. Jadi Dr. Ken pun dah cakap tentang LCP grade 1, 2, 3 tadi. Jadi itu satu yang important dalam pencarian informasi lah untuk doktor yang bertauliah. Jadi terima kasih kerana menonton dan mendengar. dan teruskan usaha untuk mencari makna dan erti.
Ya, terima kasih Ken, Dr. Ken.
You're very
Banyak
welcome.
banyak
Very
ilmu dan
useful.
tips-tips kita dapat hari ini. Dan we hope to see you in another episode. Until then, please be kind and treat each other well.